Good morning, good afternoon, good evening, beautiful light warriors, old souls, and evolving like beings alike. Today, I'm going to spill the beans and expose more secrets. I hope you've been enjoying my other videos. There are about 4 or 5 of them now, and I am setting up a membership site. So please make sure to subscribe. I forgot to mention that last time because I got so excited about sharing my stories about hypnosis patients and the successes that I had. But today, what I'm talking about is why licensed professionals can't actually tell you the truth about certain things. Now, is it that they can't tell you for fear of losing their medical license, their professional license, their insurance, their membership to universities, their status in teaching institutions? Is it that they can't tell you? Or is it that they truly just don't know because they came from a system that is so highly rigged and paid for by big pharma, universities, and donations that they never get to the point of exploring outside to find the truth for themselves? Or perhaps they come from a long line of other professionals. They think that they're doing the right thing and they just continue with their life. Now, there are many phenomenal medical doctors and phenomenal psychologists, and even some pretty great psychiatrists. So let me start by defining the difference between a psychologist, which is what I was, and a psychiatrist. For those who don't know, a psychologist does not administer medications or pharmaceuticals. We're not trained in that, which actually is a shame because I ended up doing a whole bunch of research to discover how the brain actually worked, how pharmaceuticals work. And it became a huge progression to learn that there were alternative healing methods out there and that Mother Nature and herbs could do exactly what these pharmaceuticals are doing. And they were pretty much free. But I digress. A psychiatrist goes to through medical training, and I did not want that medical training. I had no interest in it, and I didn't want to be prescribing medicines. This is the reason why I did not become a psychiatrist. And again, before everybody gets their feathers all ruffled, there are beautiful, beautiful people in this world, professionals who are out there helping. But my message in this video and the next one is that no professional there is to tell you how it is. You have to take control of your own healing, or you're responsible for what it is they're doling out. So I'm hoping that by revealing some of these secrets, some of this information that most people will not talk about in the professional field, that it will encourage you to step up, claim your rights, learn more, and actually finally get healed without all the craziness that's going on. Now, when I was very young, probably around 7 years old, I started having dreams about working with kids with cancer. So I knew that a part of my mission was going to be working with children. I had an incredible fascination with dreams, and I had an incredible later fascination with drawings and how they told the truth about what was really going on with a person that had nothing to do with a diagnosis. So by the time I was 15, I started volunteering in New York City at one of the major hospitals. And there was a field called child life specialist. And that's where wonderful, either volunteers or loving people worked with children with illnesses and disabilities. And their work was focused through play therapy. And I'll tell you, if you want to get into a child's mind quickly, sit down and play, because they will show you, they will draw for you, they will give you everything that you need. But professionals may not necessarily be trained in that. My acuity for understanding dreams and drawings was so strong that when I did eventually enter hospital fields working with cancer, kids with cancer, which was my dream, I loved every bit of it. I would go back in a minute today if I knew we could give holistic ways of healing, because the way that we're treating cancer right now is a whole other video. So by the time I arrived in the hospital setting and was working with kids with cancer, blood disorders, and other illnesses, I was really young. I was 19 years old. And by the time I was 24, I had my doctorate. I went to college when I was 15, turning 16. So I was young, I was driven, and the great part is I could really relate to the children and hear them, but I had this whole other knowledge. And I walked in that knowledge no matter what was being done to me by administration, by other professionals. And I want to share with you a story of how distorted our system is. In psychology, when you go to school, you often learn about child developmental styles. You certainly learn about diagnosis codes. And there's something called the Diagnostic and Statistical Manual. And we use this manual to label what is happening to the child. Again, I will do another video on how inappropriate labeling is, but sometimes a little necessary in this world. So, in the circumstance of labeling, there was this crazy section that I read in the manual at the time. Now, I have not read the updated manual, and please, I was on the third manual. However, I have to tell you, some of the manuals got even scarier because they were forcing children into situations of defining sexuality. Again, another video. But during this point, when I worked with kids with cancer, of course, many were terminal. So we would talk about things. We would talk about dreams. We would talk about afterlife. We would talk about what would happen if they wouldn't be there. We would talk about anything they needed to talk about. And if they didn't want to talk, we drew, we played, we created, and we made the most of every moment that we had. Memories, so incredible, such precious moments, and I'm so grateful to every one of them. I'm getting choked up. Anyways, this one situation was my client was having out-of-body experiences, and she called a nurse to talk to the nurse about it. And the nurse was like, oh no, we better call in the psychiatrist. We better add some meds to that program because this kid is having out-of-body experiences. Those don't exist. Something's wrong. So the psychiatrist came in, did the evaluation. According to the book, the kid was delusional. No, this child was not delusional. This child was having an out-of-body experience. And this is the truth. If it doesn't resonate with you, that's okay. But if you can expand your mind, I'm asking you to think about this. We are multi-dimensional beings living in this little suit, this little place placed on planet Earth. But this little piece, this little body we have right here, is the smallest portion of the being that we have. We are connected to Source. We are connected multidimensionally to other universes and other places. I don't care who you are, unless you truly don't have a soul. So, these out of body experiences were there to help the child adjust to the death process and make it as comfortable as possible. Drugging them more or telling them that it didn't exist, to me, was not an answer. I don't care how old I was. So what did I do? I marched myself into the room. I worked with a child, got rid of all the fear, got rid of all the grief. The child was the happiest they had ever seen. And I went and I documented that we discussed out of body experiences. Well, I was hauled out to the head administrator so quickly you couldn't blink. I don't think I had even walked into another ward before they actually called me in. The psychiatrist sat me down and said, "You can't do this. This child is delusional." And I just sat there. There was nothing I could do. So little by little, as I expanded my work, of course I was going to keep doing what I was doing. I had a higher calling and I answer to Source. I do not answer to anybody else. And the only thing that I cared about was that these children were cared for in the best way they possibly could. And no one was going to tell me how that was going to be done. Did it get me in trouble a lot? It did. But the children love me and the parents love me too. And many parents, which you can imagine, could not even cope with knowing all the information. I would offer and ask, would you like me to share some pieces if the child allowed me? But oftentimes, their level of grief and being overwhelmed and trying to take care of the medications and having a family and trying to go to work and trying to keep a job and trying to live was so much that they were just grateful somebody else was there to do the talking. So my point is, if we live in a system that in a sense is rigged because we believe our body is the only thing here, we are limiting our healing abilities, whether it's through medicine, psychology, psychiatry, mental health, whatever it is, addiction therapy, anything, because the actual illnesses and issues that come in very likely could have come in with you. So the best way to help yourself heal is to expand your thinking and to understand that the system is going to categorize you. And I hate to say it, but it will most likely categorize you incorrectly because they have been indoctrinated in their professional association to believe certain things. And because they cannot expand, the professionals cannot expand their thinking, they cannot serve you and help you as an entire multidimensional being that you are, who has inside of you, in your DNA, the ability to heal yourself. So when you go out looking for help from a therapist, from a professional, from a medical doctor. You have to go out there knowing that you are in charge. You are in control. Don't give your power away. If someone tells you you need to take this or do this because this is the way that it's always been done, or I'm the authority, you need to run as far away as possible. You need to step into a quiet place and go into your heart and ask yourself, does this feel right to me? For many, they start to take medications and they feel worse. Some of the psychological medications cause people to become suicidal. How could this possibly be helping? So I'm asking you to put on your rational thinking in the sense of, really, are they the authority of all? Are they the God over me? Do they really know? Have they really been trained in the truth? And if the answer comes down to the fact that they have all these degrees and all this training, some so valid, but my point being is they have no more than you internally have been gifted upon your arrival to Earth. The only person disconnecting you from Source is you, which is the reason I had the power not only to heal myself, but to help others learn how to heal themselves. And yes, there were some incredible miracles along the way. Situations where I had children with cancer whose veins were so swollen, so blue, crying in pain, and I was able to literally put my hands over them and take away the pain, and we could honestly watch together as it disappeared. My favorite, with just a love of my life patient who did pass away, was a situation where she and I just did the healing together. It was bad. The bruising and the swelling and the pain and the throwing up, it was bad. So we created this entire space. I literally did the hands-on healing and the bruising disappeared, the swelling went away. The doctor ran in, took one look and went, "Oh, I did a great job." We both looked at each other after he left and burst out laughing because we knew. We knew. Go into your heart. Go into what you know is the truth. Look at these systems as little guides, but then go into yourself and take your power back. Because if you are taking something that has been demanded by a government or a medication, because that's what's always done, you are limiting yourself. You can heal yourself. You are gifted. And you are loved. And there is a team of angels and guides and multidimensional beings that want to see you succeed. And that's my message for today. I am working on a membership group. Please like, subscribe, share. Any information we can get out will be wonderful. I will be talking about the value of phenomenal light workers to go along with the fact that they don't need some of these professional licensings because they are so much more brilliant than their knowledge base is obviously coming from source. So have a beautiful, beautiful day on your journey. Go out, re-look at life. It's not what you think. And new energies are coming in. Your DNA is being upgraded and repaired, whether you like it or not. So the question is, do you want to embrace it? Isn't it time to finally get healed? I think so. Love you.